Hello everyone. Hello. Who's there? Hello. Can I see 1, 2, 3 drop by? Hey, there's one. A hump day, right? It's always busy. The week starts, Wednesday comes. Oh my God, you don't even realize that it's almost weekend, right? In 2 days' time, it's almost weekend. Right. It's good that we have a 5-day working day, right? Not like other countries wherein you have to work for 6 days a week. Some do work 6 days a week. I'm happy doing 5 days a week. Hey! Right. Oh, good. It's picking up its gear now. I'm so pleased that we are doing session number 36 today. Right? Wow, time just flies. Every week is an interesting week, right? And today's session is all about oral health or dental care. I have got a bright and young and bubbly dentist who is going to talk all about dental health, right? How to look after, what to do, etc., etc. in a short while. She's just eagerly waiting. Oh my goodness, I'm so happy to present her, right? And you know what? Dental health is important as any other health, like just general health, right? So one has to take care of dental health slash oral health in a structured way so that you don't need to see dentists often, right? It's just so dreading to go to the dentist. Everyone dreads to go to the dentist. It's just the thought of the drill, right? That's the one which makes everyone uneasy, right? Just the sound of it. Oh, nice. Oh dear. Oh no, oh no. And anyway, I will be starting off. Right, tonight's sari is a off-white sari which has got beautiful golden motifs, and I'll be posting it tonight. And this is what the sari, and it's got beautiful kind of like leaf motifs throughout the sari, and it's a georgette one, and it's sheer in texture and lightweight and easy to carry, and it just falls so perfectly. Just love the sari, right? And I've just paired with, I wasn't able to fit into the matching blouse, so I had to kind of like come up with another golden color to match with the sari. So I'm just wearing a gold colored blouse, right? So this is what my sari I'll be posting tonight. Anyway, right, as I mentioned, you know what? A female dentist is called a dentite. Did you all know that? Oh, yes. And dentist is the only person who can say, open your mouth and shut your mouth. My goodness, they are the only ones who can do that, right? Not anyone else can do it. They are the only ones who have the liberty to do it. Just shut your mouth up, right? All right, okay. Now, let me introduce Keertana to you, Dr. Keertana Avalur, who is eagerly waiting. So am I. She is a very fresh graduate who has done her dentistry, and she from La Trobe University in Victoria, in Melbourne, in Australia. And she's just graduated, and she's working as a dentist in the local suburbs in Parramatta and Rocken Hills. And she was so bubbly and energetic, and as soon as I approached her, she was so willing to do this talk for me, and I was eagerly waiting to put this topic on, even prior to session number 36, but it just kind of like, it just went on dragging, and then finally she agreed to do. And she has got other things as well to carry on. She's also a swimming instructor. She has completed her Bharatanatyam Arangetram in 2018, and she is a Bharatanatyam dancer as well. Right, so a dentist, a dancer, a swimming instructor. What else do you want? Oh my God, her extracurricular activities just blew me away. Right? She was born in Pune, but they migrated when she was 1 year old. So basically, she's born and brought up here in Sydney. She's a Sydney girl, but studied in Melbourne. So she's been all over the place, but from Australia. And she's going to talk about how to look after dental health and oral health, and what's necessary and what needs to be looked for, etc., etc., etc. And she would be the perfect one to tell us more about dental care. Okay, I'll just bring her on to the camera. Just bear with me. I hope I should be able to do that. I have already invited her. 1 second. Okay, Keertana, I have added you. Are you able to accept? Keertana? I'll just see whether this one is much easier. I am trying to add Keertana. I just can't see you there for some reason. I don't know why. Yeah, I have added you. Can you request that? And I will end this session because I've got both my laptop as well as my mobile going at the same time. I'll just end this.
Sorry about the technology. I think it was playing up for me. All right. So I'll just probably wait a few minutes before I start. I think hopefully a couple of people will log on now. But anyways, I'm Keertana, so I'll be talking to you about dental health. Ideally, I would have liked Hemanti to be on this. It would have been fun to have an interactive session. But hopefully I can keep you entertained with what I have. All right, I can see one person is on. All right, awesome. Hi, Auntie. Cool. I'll just wait a little bit. Sorry about the disruption. So hopefully everybody's keeping well with COVID, everyone's staying safe and just staying healthy. So thank you, Hemanti, for giving me this opportunity to talk to you about something that I'm really passionate about, which is dental health. So yeah, it's really good that we have a Sari Lovers page here, and there's so many interesting topics that we've covered so far, and it's definitely very relevant and makes us a more aware society. So this is a really good opportunity for everyone.
I don't think
Oh, I think, sorry, it's my family. I think everyone can hear. Okay. Okay, so I'll just I'll go over a couple of topics that will be quite relevant to everyone. So first of all, in terms of what dentists actually do during checkups, so that's one of the first things that everyone should be doing, 6 monthly checkups. So as dentists, we not only are looking at the teeth, but we're looking at the gums, we're looking at the saliva, any abnormalities in the soft tissue. So that means the lips, the tongue. We also assess the breathing patterns, especially of young children. So that actually identifies any underlying pathology or underlying conditions which may have not been previously detected. We also take lots of x-rays, and this also includes OPG. So an OPG is a full mouth x-ray, and we also take photos, intraoral, so photos inside the mouth and outside the mouth, also to detect any conditions that may be present. So having good oral health is a key indicator to have a healthy lifestyle, to be able to talk, eat, smile, and just overall feel very healthy. So it's necessary to attend 6 monthly checkups with your dentist, as I said previously, and this way we can actually identify if there's any conditions, follow it up, monitor it. Obviously, each individual is to be treated on a case-by-case basis. So if anybody has any specific conditions, it's best that you go seek your dental practitioner. Today I'm just giving you a general idea of some of the common conditions that we might be seeing. So it's not a good idea to just visit a dentist when you have pain. First of all, the problem with that is you are in a lot of pain. And second of all, it might be that the condition that you have has progressed so far, and it might actually be costly for you to treat. So dentists are not expensive unless you keep ignoring the conditions. So some of the common conditions that we might face is, first of all, dental decay. So this is known as a cavity. So how does this cavity form? It's formed when there's actually bacteria on the tooth, and it starts to eat away at the tooth. So there are a number of reasons why cavities may be forming, and it's not just sufficient to brush twice daily. You also need to be monitoring your diet. So that means reducing your sugar intake. Increased frequency of sugars increases the risk of developing cavities. Other reasons why you might develop cavities is patients may have reduced saliva, and also they may be experiencing dry mouth. So this may be due to having multiple medications. So definitely inform your dentist if you are on a number of medications, as this can affect treatment. And patients may also be on chemo or radiation therapy, which may be causing dry mouth. So this does affect development of cavities. So when a cavity forms, it may actually be quite small, and it's best to site it at that point rather than letting it progress all the way. And once it progresses all the way, you're likely to be experiencing getting more extensive treatments. So identifying it when it's at its early stages is very important, which is why we recommend doing checkups. Another thing is filling on a tooth is not like your natural tooth. So a filling is likely to degrade over time. Why? Because you might be getting recurrent decay occurring, which is there's more bacteria developing on the tooth. And secondly, there actually might be increased pressure being applied onto the tooth. So a number of reasons may lead to the breakdown of a filling. So that's why preserve your natural tooth as much as possible. So having these preventive measures, improving your oral hygiene is extremely important. So another thing patients may come up with is having bleeding gums. So as dentists, as I said before, we do assess the bleeding of your gums, and bleeding gums is an indication that there is active gum disease. So that means it might start off with just some bleeding and inflammation. If it progresses because there's bacteria that continues to grow underneath the tooth, that goes under the gums, it leads to bone loss. Once you get severe bone loss, you're going to get mobility of the tooth, and it's very hard to save. So at the point where it's so severe, it needs to come out. We don't want that to happen, so stop it at its early stage. Gum disease is known as periodontal disease. So this is the term that you might hear from your dentist if you do, if they do tell you about this when they do your checkups. I actually have some diagrams here. So this is basically one of the diagrams I have. Hopefully you can see it. So this is what I said, periodontal disease or periodontitis, and you're actually causing bone loss to occur. And you can see here, so that's basically a ruler that we use. And when we put that in, we measure how much the gum levels are. We assess if there's any bleeding. So those are all indications for us when there's some sort of gum disease occurring. Some people who are at high risk are those who are smokers. So definitely reduce and stop smoking, because not only does it cause gum disease, but secondly, it can cause dental decay or cavities because it's causing a drying effect in the mouth and it leads to those cavities forming. Another condition which may be causing periodontal disease or gum disease occurring is uncontrolled diabetes. So those patients are at high risk of even having increased risk of infection and poor wound healing. So make sure you visit your GP as well for regular checkups to control your glucose levels, your diabetes condition. Other conditions that we might see commonly in adults is cracked teeth. In children, we might see dental trauma or thumb sucking. So patients who are presenting with cracked teeth, this may occur due to some very common causes like eating nuts or popcorn kernels, grinding, clenching teeth, missing back teeth, or previously placed silver fillings. The nature of these silver fillings, which is amalgam, they tend to expand, and so it basically causes some crack lines to form. So just be wary of those. If you do see any crack lines or your dentist identifies them, it's definitely important to address it, and you'd need to speak to them regarding the treatment options for that. So those patients who have crack lines that are extending so far, they might even need root canal treatment, or they might even need to be extracted at some stage. So I have a cute little model here of a tooth. So I'll just show you where exactly crack lines may be forming. So they may be running across the tooth on the top surface. They could be running down the tooth around, along the roots. I've actually seen some patients with crack lines that are going horizontally as well. So they're all, long term, it's not good to be having these crack lines present. Regarding children, obviously a number of you may be having children. So kids are very active. They run around, they knock things, they jump into things. So they develop dental trauma. So that's something that we commonly see. And as soon as you do see a child that's experienced dental trauma, it's important to go visit a dentist so that there's appropriate treatment that can be done for them. So some kids may actually lose their baby tooth. So that means the entire tooth has actually come out. In that situation, it's important not to replace this tooth back into the mouth. Whereas if it is a permanent tooth, so not a baby tooth, if you are able to, you pick it up. First of all, you stay calm. You pick it up by the crown of the tooth. So the crown is the top bit of the tooth, not by the roots. So we pick it up by the crown. If it's dirty, you might want to rinse it quickly in some milk and replace it back in, and ask, get a handkerchief and ask the child to just bite down on it so it's in the right position. If you're not able to replace the tooth, that's when it's completely come out. Then put it in some milk or put it in some saline and then bring it to the dentist as soon as possible. Long-term outcomes will need to be reviewed because at some stage they might need, again, root canal treatment. They might need to be extracted. So there's some of the options that may be occurring if it's not managed appropriately. Another thing is if a child has knocked their tooth and there's signs of bleeding or the tooth looks like it's not in the right position, definitely visit your dental practitioner as soon as possible. Another thing that children commonly do is thumb sucking. I myself have been a thumb sucker, so basically, not only was I sucking my thumb, but I was also scratching my forehead. If you can see my forehead here, there's a little dent. So that's because of me thumb sucking. My mom thankfully identified this very early on for me. So I was actually able to stop, and I didn't develop any damage to my teeth as such, but obviously I have some other damage here. But otherwise, if you do see a child thumb sucking, it's best to stop this at an early stage before around 4 to 6 years. Why? Because it does affect speech. It can affect the child psychologically as well. And what tends to happen is the upper front teeth become quite narrow. They're pushed forward. Lower teeth can be pushed back. It can affect their speaking or their eating. It can really affect the child's lifestyle. So ways that you can stop the child from doing it is, first of all, just simple acknowledgement and telling the child, look at what you're doing. Like my mom did. She showed me a mirror and she's like, look at what's happening to your face. Look at what's happening to your head. Don't suck your thumb. Clearly, she tried to pull my arms back whenever I was doing it, but I continued to do it. So sometimes that doesn't work. So just positive reinforcement to the child is also quite effective. And also trying to put something bitter on the finger, maybe like some nail polish or a Band-Aid that stops the child from moving the thumb into the mouth. Another thing that they could do is an elbow restraint. So you're actually pushing the child's arm back and they can't move it upwards. So those are some strategies. Long term, if this can't be controlled, then something like orthodontic treatment might need to be considered in those situations to actually control the thumb sucking. And if the child's teeth later down the track are quite malformed or malpositioned, then they might need a longer course of orthodontic treatment. So the earlier you stop it, the better it is. Also, some people do wear dentures, so it's important that we take care of these dentures. So some of the advice that we do give, first of all, a denture is a removable appliance, or it's also known as a plate. So it has some artificial teeth when patients have some missing teeth. So these can be full dentures or they can be partial dentures or plates. So some individuals do have to take care of these dentures quite well. That means that overnight, don't leave it soaking in water. Leave it out to dry, because it actually causes more bacteria to accumulate if you do leave it in water overnight, and you have constant expansion and contraction occurring by leaving it in water. So leave it out. And also, we're giving room for our gums to actually breathe and to just be in a healthy state, at least for a couple of hours when they're not in the mouth. So we're not making them red and inflamed if you do leave it in overnight. And by taking them out as well overnight, you're actually allowing reduced risk of infection from occurring. So dentures should ideally be cleaned with soap and a toothbrush. If there are deposits that are built up on those dentures, then you can consider soaking it in some white vinegar overnight for a couple of hours, and then just leaving it out to dry again. So some other things, other than just denture hygiene, we're going to be talking more about common tips that we all need to follow in terms of maintaining our oral health at home. So first of all, my overall recommendations: brushing twice daily. We're using a soft toothbrush. Soft is better for our gums rather than using a medium or a hard toothbrush, because otherwise we cause something called gum recession, and that can cause a lot of sensitivity. And we're using only a pea-sized amount of toothpaste, which is with fluoride toothpaste. So fluoride, obviously, it is increasing the stiffness of the tooth, so you're incorporating minerals onto the tooth, and it's less likely to break down. That is forming cavities. And the current recommendation is, normally when we brush our teeth, we don't like the taste. We want to rinse out our mouth of the toothpaste. But the current recommendation is that we spit out excess toothpaste and we leave as much toothpaste as we can in our mouth, so that it can actually have a beneficial effect for our teeth. However, for children aged from 18 months to 6 years, it's recommended that you use a children's toothpaste, which has less fluoride. And for those who are younger than 18 months, we recommend parents are still to brush their children's teeth twice daily, but with no toothpaste. So I have a couple of devices here that would be good to clean between our teeth with. So commonly used is what we call a floss. So basically I have a bit of floss here, and all you do, you just wrap it between your middle fingers like this, and you hold the floss in like a C shape, and you're just doing some swaying motions. You don't like jab the floss down into your gums because it actually causes more damage to your gums. So just gentle seesaw rocking motions down your gums, so that we're cleaning in between our teeth. So that means our teeth are pretty much edge to edge like this, but the brush, like a normal toothbrush, you're actually missing these narrower areas, so that's where the floss is very helpful. Or we have something like this. It's a Pixstar or an interdental brush, so you can actually bend it in a lot of ways, and this is very easy to find in a number of supermarkets. So it just needs to be put in and out, in and out, in and out. So very easy to use, and they can actually be cleaned and then reused. But obviously if it becomes quite frayed and it's not cleansable anymore, you don't need to keep reusing this. Use another one. Everyone has a different size of space between their teeth, so you need to choose an appropriate size for this brush. That's the only thing. You might need to experiment a little bit. And there's a lot of other tools out there to clean between your teeth. Pretty much it's important, otherwise you will develop decay between those areas, which are really quite hard to clean just with a toothbrush. The other thing is attend your dentist again for regular checkups, 6 monthly, to actually identify any of these signs of disease, and which can be treated earlier on. So I was talking about earlier on, patients may be experiencing dry mouth, and dry mouth can actually trigger developing cavities to form. So some of the ways we can actually reduce this dryness is to increase our intake of water, obviously, and having chewy foods, having sugar-free chewing gum. Chewy foods can include something like celery, so it increases the saliva flow. Avoid smoking, avoid acidic foods, and reducing alcohol and caffeine intake. Another strategy is to have saltwater mouth rinses. So a teaspoon of salt in a cup of warm water is very helpful. And pretty much you can do this at any time of the day. You can do this mouthwash. Otherwise, normal mouthwashes are not really essential. Brushing and flossing or something to use between your teeth is essential. Mouthwashes are not that essential. In fact, I don't really recommend it at all that often. But if you do want to use a mouthwash, use something that's alcohol-free, because there is a link between oral cancer and alcohol-based mouthwashes. So just be wary of that. So I've just given a general overview of some of the things we need to consider in terms of our dental health. Hopefully it was helpful for you. There are dentists that work in hospitals, in community clinics, private clinics. So definitely seek them if you need any further specific advice. And hopefully this was somewhat helpful for you all. And thanks Hema and to you for letting me talk about oral health, dental health. And actually, I'll show you the sari that I'm wearing right now. So it's actually, it's from a Canadian store. So it's called Tia Buba. So I'm actually wearing a blush colored sari. It's a satin silk material. It's about 6 yards. And we've got like a sequined rose gold top, and it's a 3/4 sleeve. And I'm wearing an underskirt that's also from the same store. It's actually, I'll turn. So, yeah. So it's actually, like the underskirt is also from the store. It's a mermaid shaped underskirt with a slit. So it's very easy to sit with, and it's very breathable. It's a spandex material. I'm just gonna see if I can add Hema and T. I'm not sure how to do that. Let's see if I can add. Okay. Honestly, I've never done a live video before, so I'm not sure how to use this, but Thanks, Hemanti, for letting me talk. And hopefully everyone's gained something out of it. And yeah, so hope everybody stays safe. Take care. And I'll be watching all the other live videos that are happening.
Don't switch off. She'll take over.
Okay.
Hemanti, take over.
Hemanti, you can probably take over if you can. Otherwise, I'll just stop this.
No, don't stop. Just send message.
Just a sec.
Send message in the 6.
Thanks, Sumananti. So Hemanti, should I end the video?
No, I think so.
I'm getting side advice from my mom. Save the video. Oh, okay. Let's try and see how to save this. Do you know where oh, right, okay, cool. I'll finish it and then save it then. Okay, thanks everyone for watching. See you, take care.
You can save, is it?
Hi everyone. Hello. Thank you, Keertana. Thank you so much for that informative talk. It was excellent. You know, it did not go as we planned, but that's all right. As long as the information is relayed and that's being taken on board. It was so lovely. It was so good and very easy to follow, good tips, and of course, to take care of our dental health. Thank you so much. Thank you. Who is there? Come on, ladies. Someone wanted to be on the camera. Hello? Who wanted to come on camera? And I would appreciate your comments. It's really nice because that's the only way Keertana would know whether she did a good job or not. According to me, she has done an excellent job. She will get 100 out of 100. A budding dentist, right? So very good, Keertana. I'm so impressed. And I had heaps of questions, right? I had a full gadgets here, like, you know, like a gadget store. I had, like, you know, I wanted to ask her, you know, whether to use an electric toothbrush or the one which is operated using the batteries, or the humble toothbrush with nothing, like, you know, whether she did mention that, you know, going for soft bristles. You know, when we were in India, it was always no, use the hard one. Like, once we came here, we realized that it wasn't the hard one, it was just the soft or the medium ones that needs to be used, because it is good to take care of the enamel as well. So that is what it affects. Keertana, correct me if I'm wrong. So these were my gadgets for brushing the teeth. And then I had my beautiful, beautiful flosses, different kinds of flosses. You know what? My husband and my son love these ones, like, right? The dental floss. This is one kind, and this is another kind. Oh my God, I've got a full shop here. And this is another one, another type, and this is the humble floss, right? And this is what we have grown up with, and this is the one. So I just wanted to ask Keertana, like, which one, what to use, etc., etc. But yeah, like as she said, flossing is as important as anything. So which will be taken care of during our normal brushing process, brush twice a day. I had heaps of questions to ask her, like, I get a lot of coffee stains because I love coffee, and I wanted to ask her about that. Every 6 months is the visit to the dentist, like, to get it cleaned. So is it good to go every 6 months, or is it good to go once a year? So those were the type of questions I had in mind, Keertana. But anyway, not to kind of like, I cannot bring you on camera for some reason. I don't know why it is not letting me. I have created the event just for like normal event, but for some reason it's not letting me in. I would not have a clue. But anyway, and I had heaps of other questions. Do people who wear dentures go to the dentist? That's the question I had. If you're listening to me, Keertana, you can answer that question. Do they, or do they have to go regularly, or do they just have to go for their gum health or anything else? I wouldn't have a clue because they won't be having any teeth, right? It's just the artificial teeth which they would be having. So I don't know. Perhaps maybe you can answer me. That was the question I had in mind, right? And what else is happening? Come on, I did have a call from someone wanting to do something. I wasn't sure what it was, and if you're watching, I know who I'm targeting. Message me your number. I would be happy to get in touch with you. And just stay tuned for the next week's session. It will be an interesting session as well. Kind of like, approaching the holistic way of doing things. We finished kind of like, yoga, which was the facial yoga last week, and that was a brilliant one, right? So how many of you have been doing that? It looks so simple, and I kind of like, try and do a little bit, not too much, but a little bit, maybe like, maybe 30 seconds or something. Gradually I have to increase the time. So though that was really, really good. Like there were simple exercises, and it's kind of like quick, like, by the time you kind of like, finish your shower and get ready, and it's just another way, or like, to spend some time in front of the mirror, right? Looking at your beautiful face. So that's another way which I would look at it. So I have been kind of like doing bits and pieces, though not regularly, but maybe I think in the last week I have done about 4 times, which is good, right? So I kind of like forget, like, you're always in the rush to go, and you kind of like get ready and then you're done and dusted. But I would encourage you all to kind of like follow bits and pieces. Something is better than nothing. So that's what my motto would be. And that is what it is. And thank you, ladies. Thank you very much for letting both Keertana and myself into this afternoon session to present this beautiful talk and to look after your dental health / oral health, which is as important as general health, as Keertana was mentioning. So please do look after that, and I will be in touch with you all next week, same time, and the next event would be publicized on Sunday. Keep those eyes open so that you're well aware of what's happening the next week, and please don't miss them. Even if you have missed, it's all right. You can still go and replay the session. It's called the watch party. You're most welcome to do that. And I would encourage you all to do so, that it's an opportunity for the ones whoever has not watched can watch it, and you can go live in that way. All right, I will be signing off. Thank you so much. I will see you all next week. Hema signing off. Bye for now.